Well, we're still gathering, but one of our guests tonight, Kate, has to be at work at 6. So I would like to introduce you all to Kate Heise. And she's going to present with Dr. Kashyap, correct? Rahul. Got it. I've got the agenda up so you guys can tell I'm just terrible with names, but I love your enthusiasm, both of you. Thank you so much. So we're going to present to you a project that you all are working on. So why don't you give us a little context? And
so as we, is it all right if I
absolutely.
use the mic? You like the mic?
That's what it's for.
Yeah.
Oh, here we go.
Or I can just use the mic. I'll just stand up here.
I worked for 43 years.
Testing.
People, and I kept saying, use the microphone. I can't hear you.
Does this work? Okay. So when we have our patients in the ICU, we have this checklist as providers that we do every day to make sure that we're doing the quality markers that are evidence-based. These are the best things for patients in the ICU to get better, quicker. So we do that as providers every day. But then the family comes in and we talk about these same things and we go on these, oh, well, we're doing this lung protective ventilation. And nobody really knows what we're talking about. In general, I think in medicine we tend to do that. But so after a few conversations about this and how this checklist that we do should maybe translate to the family members and patients, since they have more insight into their own personal health care than we do, meeting them for the first time in this acute crisis situation, we thought, why not have the family members or the patient, if they're alert and speaking, but a lot of times for us in the ICU, it's family members that would be doing this. Why don't we see what their input is on these same types of areas? And then not only can they see what we're doing for these quality markers, but then it can transition into these conversations about, well, this is why we're doing this with the ventilator, and this is our goal for the day, and this is how we can get them better and get that tube out. Or this is what we're doing with these medications that normally we just give the medications, right? We don't really talk about what we're doing with them. But we can say, you know, we're on these medications to support blood pressure today. This is where we're going. We're titrating these down, or unfortunately we're titrating them up, things like that. And get those conversations rolling about this is what we're doing, this is what we're going for, these are our goals for the day, and this is why we're doing them. So not only helping us make sure we're kind of keeping on track with everything, also engaging the family members and the patients that can participate in their care and in their ICU stay, so it's not such a foreign environment and just this, oh my gosh, everybody's really sick, we don't know what's going on, and everybody's just really worried. And then, just like I said, for me, it's really about having those conversations about what's going on. So you have three pieces of paper, I guess. The first is, that's not stapled, is the checklist itself as it stands right now. We've had a few people look at this, but what we're really looking for is your guys' feedback on if it makes any kind of sense, if something could be worded better, if maybe something should be combined or omitted. And then on the second piece of paper that's stapled together, there's places for you guys to put comments on there, or you can also just put comments on the checklist itself, or underline or cross out or replace a word or something if you think something's better. So we can, if you want, talk about each question. And then, like she said, I have to be to work at 6, so by 5:50, if we're not done, which I anticipate we will be, then Rahul will take over for me and go from there.
Well, and one of the things I'm also going to call out is we're recording this, and what we did last month is we put the video recording on the community, and the survey will also be there as well. So we'll have conversation, but if we don't finish, we can continue it on the virtual community.
I have a comment. We can send this survey to hundreds of doctors and nurses at Mayo Clinic and outside and think that this is the best thing we are doing. But I think it's going to be more beneficial if we get some subjective comments from you guys. We're going to get more insight from 8 of you guys today than sending it to 100 doctors and nurses, because it's going to be hard for them to think from a family perspective. We still live in that jargon area that we can like to talk about acronyms and things which might be French to our patients or our family members. So we really appreciate any subjective comment for any question. Something, if each of you say one question doesn't make sense, that's going to give us 8 different variation for the question. So we really appreciate if you can make any comments, stop us in between, or write down your thoughts with each question.
Should we read the questions and maybe take them one-on-one so we can think together? I can guide this if you want to read off the screen. Sure.
If there's no issue, we can just keep moving, and if there's any issue, we can discuss with that particular.
Question.
Is this what the actual paper is that would be handed to the family?
Currently, and it would come with an instruction sheet and a clipboard and a pen.
We've never had the experience of having any of this happen.
Okay, and that's pretty common, so actually that's really great feedback. So just picture something, you know, you're in the ICU and your loved one's there with you, and since you haven't had this happen, that's actually going to be great feedback for us, because that's kind of our target population of who's needing this the most. Do you know what I mean?
In that first question, my wife just said we never had one.
Mhm.
So do you want us to
So-
skip to question 2 then, or do you want
Well,
us to assume?
let's do a scenario, how about?
Yeah.
So, well, it's kind of mean to picture this, but picture, you know, your loved one is, something happened, you got a phone call, something happened and they're in the ICU, they're intubated, and you come in for the morning rounds has happened. So what happens is the doctor or provider team walks around the ICU and they go to each patient room and they talk about the plan for the day. And you can be, if you're there, you'll be included in that. If you're not, you may come later. So say you come after that and they say, you know, we've already had rounds, but here's something that we kind of go through in rounds, so this is a checklist. So then first question is your family member having lung protective ventilation? What is it? Is your loved one on a breathing machine? So let's say yes. Are we doing lung protective ventilation? Are we doing any weaning, and we're doing a sedation vacation? So your nurse is going to be in the room, and you can say, okay, so are we doing this lung protective ventilation? And we'll say, yes, what we do is a low tidal volume strategy, so we give small breaths so we don't distress the lungs or injure the lungs more from the ventilator. Are we doing weaning? And that may be yes or no. And a lot of these are going to be, it's going to have to be interactive and a conversation with the provider or the nurse.
And for the exercise purpose, we can assume that answer to each question is yes. So we go through with maximum possible iterations of all combinations. So let's say it's yes, and second question also is yes or anything else. So just for exercise purpose. All things might not be applicable for your loved ones during that time, but just for today's exercise purpose, we're keeping it in, let's say, answers are yes for every question.
So basically what you're asking is, if this applied to us, is this an appropriate way to ask the question?
Yes. Yes. Thank you.
Thank you.
One comment that you made, I'm sorry.
Speak
One
loud, because
comment
we're
that you
recording.
made earlier about where are we going with these questions, I think is very valuable. At least if I was a family member and I had a loved one there. So you ask the question, is there a change in the amount of confusion with your loved one you're experiencing? Where are we going with that comment?
So I can take that. So,
Basically, like, what are they looking for with that question?
Yeah, or where,
Our idea is that there's no right or wrong answer. As soon as you bring up, this thing needs to be discussed, because what happens is some things are not discussed during every round. Our idea is if family member can bring up these questions, they get discussed, there's more clarity in terms of family prospect, and there is more clarity in terms of the team they're taking care of it. So it's a checklist you're providing them, giving them cues saying, have you discussed about it? And they might not be a right or wrong answer for it, but at least bringing up might
Trigger it.
and do you want me to watch my loved one for these kinds of signs?
Right, so, and like the confusion question is a big one for us, because we aren't gonna know what the baseline is.
Right.
Because you've never met this person
Right, because we
before.
hopefully, theoretically, most of the time, never met this person before.
And that's what I think would be valuable for these folks here is,
Yeah.
here's why we're asking that question. We need you to be aware of
Right.
if there's some more confusion in the patient.
So one idea I've tossed around is having an instruction sheet, a more thorough instruction sheet that goes with it, that's like laminated and goes on the clipboard with it.
Okay.
So if you think that's something that would be valuable, let us know, because that might be.
I like the part, the science of confusion, so we can have that part of the educational material for our family members.
And just a brief bullet point for each question. Mary has a question.
So are you planning on redoing this sheet?
Yes, based on the feedback we get, because this is something that was dreamed up based on the checklist the providers do in my brain. But I see this every day, so it's not gonna be, the perspective is off. That's why we need your guys' perspective, because my perspective on this is, I see it every day,
Right.
so.
If this were handed to me and Jim was in
Can you
the-
give her the mic so we catch her comments?
Yeah.
I would feel very intimidated by this sheet
Okay, because of the length, do you think, or?
because it's so busy. There's
Okay.
too much. It's just too much. And when Jim is in the hospital, he gets a sheet, questions to ask before you're discharged. And I've been going through old hospital things, and they're all blank. No one has ever gone through them with us. And, you know, that's the kind of thing this is.
And that's the culture we're trying to change.
Thank you,
Yeah.
it's gonna help us. So there might be some formatting issues too.
We like to cut down on some questions and there might be different platforms. We might have paper versions, we might have a link if there's a computer in the room, or we can give you an iPad sort of thing and you can just have just no check box there as well. But we'll definitely look into it if we can cut down this length a little bit.
Well, just looking at the first two questions, I would say that question number 2 is very important for what you said about
Right.
not knowing the basics.
Right,
But question 1, either you're on a breathing machine or you're not.
and you're not worried about all the rest of the stuff?
You know,
Yeah,
You might not even know
you were,
about
okay,
you know, if you're,
yeah.
And one thing how it works is if they're not breathing machine, then some of the questions will not even pop up. If they are breathing machine, then so we have
If
that-
we did it electronically,
if
you
we
mean?
did it
But for
electronically.
now, you're doing the sheet.
Yes, so
Correct.
sheet because, so what happens is if they're on certain thing, you say yes, then, or say no, those next 5 questions will not even pop up. You just directly go to it, so it's gonna be even shorter. This is the lengthiest most for somebody who has everything going on in the ICU. If there are few things are not, they're not applicable, you'll not even see those questions.
The other feedback I like is about the font that gives the questioners.
well, back on question 1,
Yeah.
and we're gonna assume the person's on a ventilating machine. And, you know, that just happened yesterday, they put the person on a ventilating machine. They put them on at midnight last night. I'm there the next morning. I got this sheet. I'd have no idea what lung protective ventilation is, or ventilation weaning, or sedation, or any of that. Those questions are just Greek.
Good to know. We were thinking,
know that.
we were
I wouldn't
thinking,
know that.
Yeah,
It
she
was
would
just
know
Greek.
that.
yeah, we were thinking, if even without knowing if you bring it up, does it help doctor to think about it and discuss it? Or can we use it as an educational opportunity for our family members so they know about what they're doing?
Or is it completely
It's a great,
indifferent?
great point.
If this is a very serious case, I wouldn't even care which way it is. All I want, something done right.
Great point.
And then the size of the font, back to your saying that, you know, that it looks pretty busy, do you think the font is too small? Or do you think it's,
We can space
readable.
it out and have a bigger font, but that's not yet. And if you use electronic means,
Yeah, then it won't
iPad or
matter.
something, then we can have branching logic, so some questions will not pop up if they're not applicable.
there's gonna be some people can't handle electronic.
Right, and that's why we're starting with
And
paper
I would
too,
also
yeah.
suggest you make your font just a little bigger.
Okay.
It always has to be on white paper.
Always white paper?
Oh, yeah, if you read any statistics on paper for today, it's black on
I
white.
almost printed on color paper today.
No,
Yeah.
don't print on color.
So, would it be okay if
Okay, and would 2 sheets but a bigger font would be okay?
Yeah.
Okay,
Well, and I almost wouldn't even limit yourself to the amount of pages, because I want to build on the idea that this, and I'm sorry, I forgot
No,
your
that's
name.
right.
We've met once.
Yeah,
Tell us your name again.
I'm Brian from the Transplant Center.
Thanks, Brian.
Yeah.
What you mentioned, though, is the why behind these questions.
Yes.
And it almost feels, getting to the language conversation that I'm hearing going on, like the understanding of what these words are. There almost needs to be a narrative around some of these questions. Why are we asking these questions? And maybe it's a booklet, and maybe the design of what it is comes later. But it's the story of what you need to find from the patient and the why. We don't know your loved one, so any information you can tell us right now will really inform us about.
Why, I think that's a great point. Why are you asking me these questions?
Mhm.
What are you trying to get from me that I can help with the care of my loved one?
So I wouldn't limit so much to the font size and how many pages right now, but I definitely think that kind of explanation to help patients understand why you're asking these questions, like a step through.
So we probably have an instruction sheet that go with this, explaining what is the purpose, and then having, but I think we can add a
I
description
think
about
that,
each.
yeah, I like the narrative better, like more of a,
So we can have a story and.
I get what you're saying, yeah, I like it. The story with the question, the story with,
Yeah. And what do you need to know first? And almost this language, I tend to agree with you. I've worked in healthcare for 17 years, but I've never touched patient care. Sedation, vacation today, ventilator, weaning, lung protective ventilation. I don't know what
right, and
that is.
And that's where we started, was with our provider one, and that's why these terms are kind of in
So
there,
you
so.
almost could lose that,
Yeah.
almost. Unless you need information from the patient for the provider.
So this has been already successful. We learned so much in 2 questions already. So
Right.
you were
But I
helping
do
us.
have to go to work.
You have to go to work.
It might be out of sync with what you're doing right now. But if you're going to be spend
Give her the mic.
um,
Thank you.
if you're gonna start thinking about doing it electronically, having people do that, one thing that's really frustrating is that you've got enough on your mind as it is, and if you make a mistake electronically, how do you go back? It's easier just to do it on a piece of paper yet.
Especially if you're not, don't use an iPad every day,
Right.
and you have
And I
fingernails,
speak-
it's hard to get it right.
And I speak from experience, I just got a tablet and it's frustrating.
Kate, you go to work, but we're gonna keep talking, and we'll share the video with you, okay?
Yeah, thank you.
How about any other questions that have jumped out to people?
It seems, I don't know, looking at this, it seems to me like it would almost be more, it would be easier for me to deal with it, let's say, in a situation like that, if the questions were organized, like there's a certain set of questions in here that I think maybe you have a very valid reason for asking me, because I might be the person that knows, in terms of change and confusion, or in terms of there's one down here, unmet social, emotional, and spirit, those kinds of things, I probably would know more than you would, right? And so those should be almost organized in a way that says, these are the questions that, as a family member for the patient, we'd like to get information from you on. And then there's other questions on here that really I think are there. I would like to see them discussed, but they're more of an education for me than they are for you, right?
Yeah, for example.
And if you could break those separately, that would help.
Yeah, for example, what's today's plan for any antibiotic therapies?
Right.
Sure.
I mean, I think that's what he's getting at, is you're going to tell me and us what that plan is, because I wouldn't know.
Right.
So you're asking these questions to the nurses and doctors. We're not asking these questions to you.
Oh,
So this is a
This-
tool for patients
For
to ask
family
questions.
members to ask these questions to doctors and nurses. We're not asking these things to you guys at all.
That could be useful to
Of course. So I took it away. We had in the doctor, and then we had this electronic checklist for the clinicians. We had subheadings. We have brain-related questions. We have heart-related questions, kidney-related questions, hematology, blood lab-related questions, the lines, the devices-related question like central line or catheter, urine catheter-related question, and then we have social questions. So I took away those subheading, but I think it's a good idea if you can bring those subheading back and saying these 4 questions are related with the brain. So we're looking at how confused. Sorry, I think that was a great point you asked. So we are not asking you these questions. I'm just giving it to you to read it, say it makes sense for you guys to ask these questions to the nurse or the doctor, saying, what is the plan for these medications? And we have 3 different categories. One is general medication. Antibiotics, we sell them because if you continue for a long time, other bad things happen. You're asking, did you discuss antibiotics today? Are you stopping them? Would you continue them? So you are asking these questions to them to prompt them to think about the things which they should think it anyways. But we are kind of making it sure that by this, it's foolproof. Even though forgot about it, you raised question. I didn't hear you guys talking about devices today. What's your plan for my wife or my husband or my mom or dad? Are you taking off or not? And they discuss. There's no, you don't expecting, they say, yes, we are taking it off or we are stopping. You're just prompting them that they discuss it, because the research says when these things are discussed every day, the length of ICU stay shortens, more patients go alive home, hospital stays shorten, and people spend less dollars on healthcare. That's why we're trying to see, can we remind the doctors and nurses every single day when they are coming for rounding. This is, sorry, I think it was a huge confusion and we didn't do a good job explaining it to you, that we are not asking this question to you guys. Today we are asking you to review them if it makes sense for you to ask doctors and nurses and then have a check. Yes, go ahead, ma'am.
So for the second question, it says, is there a change in the amount of confusion to your loved one? Instead, we would be asking the doctor, is there a change in the confusion of the patient? The doctor's not asking us about our loved one.
No, they're not asking. So we will change that, because that's why sometimes you see, and then somebody brought up this morning that there's not consistency. Sometimes we have said you or your loved one and our loved one. So that's why there was some discussion, and that you're finding it confusing there. So that is a major flaw right now. I see it there. Great, thanks for bringing it up.
And then I don't want to lose the idea of clumping the questions by areas and themes.
So I wish I could show you my checklist, which has organ-based, and we thought it'll be too much to show organ-based. Why would family care? But it's looked like that might be better for understanding those questions.
So I want to be sure I understand what you're telling us. We did look at this at the start as these are kind of questions that the loved one would be trying to answer. Now are you saying, no, it's not the questions they are trying to answer. This is a question somebody should be talking to the doctor or the caregiver. So what you're retelling us is that, I'm going to go back on our question 1. You should be saying that when the doctor comes in and says, hey, you're on a breathing machine, then you're supposed to be asking, is it sedation or what is it?
Sedation?
No, I mean, that's the question I should be asking the doctor. Is that what you're saying?
The scenario, I have my loved one in ICU. I could not come yesterday when the patient came through ambulance. Now I'm here today, and then team is rounding on the patient, or they've already finished the rounding. And I come in saying, hey, I see my patient is on breathing tube. What's the plan for today? What's the plan? Are you put the patient on sedation break? And then I think we can put that education part in there. Or are you, is patient on lung protective mechanical ventilation? Doctor's not going to ask, okay, what do you mean by lung protection? They should know about it already. If they're asking you, that's not a good thing. They will not be asking you that. So they say, yes, I think, oh, thanks for reminding us. We were not thinking of it, but now, as we go along, we're going to put the patient on lung protective mechanical ventilation. So it's a mean of you reminding the team that as these things have been discussed during the round. If these things happen in front of you, Well and good. And if still you have a question, you can always raise asking. I don't know if you guys talked about those devices. Are we taking them off, or what's your plan for it? I'd say this. So there are two things happening. We are seeking your permission to validate these questions, but the purpose of these questions to have you guys remind the clinician team or the team who's taking care of about your loved ones. They will not be asking you these questions. No, you're not supposed to answer. This is not for you to answer. This is for them to answer for you.
But perhaps this discussion today is going to help create a tool that loved ones of people in ICU will get when they enter the room, and that'll help you ask the right questions. So I think just hearing your concern about these questions are informing.
So as I mentioned, I already learned a lot. This is not a final list. This needs to be changed so there's no ambiguity and there's no confusion what is meant for. So we'll take back the comments what we have today, reformat it, probably try and do in the same group or and in addition other group and see if there's less confusion in there. We'll keep doing it until it is near perfect.
Yes.
And then we can administer it as a pilot into our ICUs to our family members. I don't want to take the all time of this meeting, but if you've gone through with any other questions in the bottom one and any pressing issues saying it can't wait for next meeting, I would please speak up.
Well, another comment I've made is that some people have said, which I agree with, is that how long this is. And if you, the doctor, came in the room and I had these 18 questions for you, I'd forget probably what was after number 6 that I was going to ask. So I think this really substantiates the comments made earlier, that this should be shorter and just a few of these questions. Now, you're going to have to decide which are the most important.
A good point. I agree with you. These questions were based on what the literature suggests, that these things need to be checked every day by the clinicians on the patients who are in ICU. As I said earlier, some of these questions will not be applicable to all patients. So, and there'll be a branching, like skip to question 8 right after first. If patient is not on a breathing tube, then you just go to question 8 and now you're dealing with only 10 questions. But imagine a case that the team is standing outside the ICU room. They are talking about your loved one. You were there part of the round. That's why Mayo promotes the family members during the rounding. It was not the case 10 years back. But now they promote that family members are there. And then you hear them talking about that, let's continue the antibiotics, let's continue this thing, or let's continue that part. And part of the education part, we're listening that if we can bring up those scenarios, what does lung protective mechanical ventilation means? We're not trying to train you to define that thing, but at least once you hear what they're talking about, and you can quickly say, yeah, it's looked like out of 18 things which these guys talk to us, they've covered 15 of them and they kind of missed out in these 3. I'm going to raise my hand and talk about, hey, did you talk about I didn't hear you, I'm sorry, about these antibiotics or this catheter tube or something, or confusion. I didn't hear you about talking about my wife or my husband, my mom and dad, that how confused she is. Is it okay if you guys can discuss this in front of me or can I add something to that discussion? And that's it. So you don't have to go through the whole 18. They've already done, they're already covering most of these things anyways. But I would take your comment in account, see how we can debulk it, have it not missing any vital thing which should be done. And if something is done every single time in all patient, you don't need to see about it because they will not do it anyways. There are a few things which missed, and we will not know how much things are missed out unless we pilot it and then take off that say, hey, this is, they always talk about antibiotics, you don't have to worry about it, and we just take off that one, you don't need to remind them.
It almost appears to me as I look through these questions that there are questions that you want me as the family member to respond to, and there are questions that are on here that you want to make sure are answered by the providers, that I make sure that I hear an answer to. So I don't know if breaking it up into those kind of categories, here's the ones you need to be prepared to respond to. Are you confused? Are you getting the right spiritual needs? Are you know, those kinds of things you want me to respond to as a loved one. Then there's ones that you want me to have kind of a checklist to say, did I hear about today's antibiotic plan? Did I hear about, and kind of go off that checklist that way? I don't know if that makes sense to folks.
Yes, it did. So there's some wordings that's confusing people. So ideally, there should not be anything that you should be on. Nobody will responding. But we can have it. Did I hear about this versus can I tell about the religious belief? Can I tell about the spiritual or cultural beliefs and those things? So we can have modify the question language accordingly. Great point. Great point.
And so I think, because we do have a few more things to talk about, if you feel you've gotten enough feedback to make some changes and you're willing to come back to show this, how we can change and inform these tools that they're making for patients, that would be terrific.
That'll be great. I can collect these things at the end of the meeting. You can fill it, but I would love to come back with a modified tool and then show it to you. And we keep on doing until we think that, okay, this is not going to do any harm or any anxiety provoking thing in our family members. Then only we enroll it as a pilot.